Hi, I'm Hal Zaitchik, and I'd like to take a few minutes and tell you about your hospital here in West Pasco County. Morton Plant Mead's healthcare system is part of the Baycare Health System, a 12-hospital non-for-profit system serving Tampa Bay communities. Morton Plant Northbay has been in Newport Richey since 1965, and we have built a new hospital to serve the needs of the West Pasco patients. Being a non-for-profit healthcare system allows us to focus on improving the health of all we serve in our communities. Our team members are focused on understanding the needs of their patients and physicians, and continuously try to improve our programs and services to meet the needs of our patients and physicians. Morton Plant Northbay is a magnet-designated hospital for nursing care. The magnet designation means that our nursing care and our nurses have achieved a higher standard of quality. I believe Morton Plant Northbay is different. Our people, our compassion, and our focus for quality patient care.
Every patient in this hospital is all of our patients, not just our assignment for that day.
I loved working with the patients. I don't say that I picked nursing, I think personally it picked me.
And I try to think of myself or my own family members in that situation, how I would like to be, treated.
There's wonderful teamwork amongst everyone that works here. So, that's a nice thing to come to every day.
I've had the opportunity to travel the country and work with different companies in my profession as an architect. And one thing I can tell you is that there clearly is a difference at Morton Plant Mead's Northbay. And the difference is the way, the culture, and the philosophy of taking care of the patient and doing your ultimate best each and every day permeates the entire organization. And you can see that and feel it when you're there each and every day.
It was Sunday morning. I always ride on Sunday mornings. And I went out for my regular ride. I kind of came around a corner and there was another cyclist, and he was coming towards me on the wrong side of the trail, pretty much down the middle. So I had to make a split-second choice. I had to decide to go off the trail or run right into him. So I went off trail, and then I tried to get back on trail, and my tire got caught on the edge, and I just flipped over on my side and skidded right down the trail. I knew right away when I hit the ground that I was not going to be moving very much. I mean, I felt it. Something snapped. I couldn't move at all. I couldn't move from the position I was in. I just lay there and waited. I figured at some point another rider's going to go by. Somebody's going to be able to help me. And 2 riders did come by, and they called the ambulance for me. One of the cyclists asked, "What hospital are you taking her to?" And I said, "Well, I want to go to Northbay." I mean, it really was no choice for me. I wanted to go to Northbay. The second they brought me through the bay doors, I was surrounded by several different people. Everybody was coming over, assessing me, talking to the ambulance attendant, trying to see what my pain level was. They were asking that over and over, and they were just very calming to me, kept me calm because they were so calm. I never felt really scared at all.
Even though somebody comes into the hospital alert and orientated, but they're sick, you still need to be their voice and be there to help them and to calm their fears and let them know they're in a good place and they're safe, and we're going to do everything we can do to help them.
We all work as a team. Everybody works well together. We are pleasant from the time the person enters our doors. We help patients emotionally, physically, and mentally, I think, just with our communication.
My experience with Northbay was kind of twofold. I had the emergency room experience, and then I had the surgery here.
Let them know that you care about that. You care about who they are as a person, that they're not just a number, that they're not just in the bed, that they're an individual that has their own individual needs, their own story.
Right away, they gained my trust. When I came into the emergency room and the way that I was treated from that point, when I was given a choice of where to come back for the surgery, it was like no choice. I mean, it was very obvious that this was where I was going to come back to have my surgery.
It's a beautiful place. It's a high-tech hospital, but yet it's got that small community hospital environment. You come in, everybody's friendly. Everybody from when you first walk into the door, greet you, and it's got that little cozy hometown atmosphere to it.
the care that I got through Northbay and the doctors affiliated with Northbay, it's been a year now. I'm 100%, and I would not have thought that I would be 100% ever again. And I just know that if there's ever a problem again, this would be, no question, first place I would come to.
It's the people that we work with, it's the caring, the compassion, and again, that trickles down from our management. It really does.
I think it's vitally important to recognize that here in Pasco County, we have an absolute gem in Morton Plant Northbay Hospital because we have a high-quality, innovative healthcare provider that raises the bar as it relates to healthcare in our community. And that's very important to all of us as community members and business leaders that we continue to support the hospital and its mission to provide high-quality healthcare access to everyone in our community, our families, our friends, our neighbors, and our employees. And the more we continue to do that and support it, the more we will help to elevate that level and that quality of life here in our community.